Early to test, early to act makes one healthy, wealthy, and saves sight. The aim of modern medicine is to prevent and diagnose the diseases as early as possible. Through this video, our aim is to put across the importance of optical coherence tomography of the macular region depicting the ganglion cell complex as an early biomarker to compressive lesions of the optic nerve that can prevent blindness in young children with cellular tumors. Let's look at our first case now. An 11-year-old female was diagnosed with craniopharyngioma with absolutely no visual complaints and was referred by a neurologist for ophthalmic evaluation. Her unaided visual acuity was 6/6 in both eyes with normal color vision and normal contrast sensitivity. Optic nerve head examination was normal, but does this mean that there is no optic nerve involvement? Are we missing out on a key finding that decides whether or not a patient should undergo an early neurosurgical intervention? Let us go back to the understanding of the most common optic neuropathy that an ophthalmologist would come across. Our understanding of glaucoma over the last 4 to 5 decades has made us realize that irreversible changes are already established before functional symptoms show up. This has shifted our focus on diagnosing preperimetric glaucoma. So can this concept be applied in treating compressive optic neuropathy? Digging deep into the literature, a number of people have realized and published the importance of JCC changes in the macular region. Our patient showed thinning in the nasal JCC bilaterally, which is generally not observed in non-compressive lesions. This finding is potentially the earliest biomarker of a compressive optic neuropathy in cases of pituitary lesions. Our patient showed classical changes in the nasal macular GCC and was advised to undergo an early neurosurgical intervention to prevent any further optic nerve damage. But what if the opportunity was missed? Not knowing about a surgical decision-defining finding can lead to disastrous consequences. Here is a case of another 10-year-old girl who was diagnosed with craniopharyngioma 1 year back and now presented with bilateral low vision. She had developed functional visual deficits and optic nerve changes evident on clinical examination. The macular JCC of this patient showed predominant nasal involvement. This was something that could have been picked up in early stages. So this is how an ophthalmologist can guide a neurosurgeon in managing the child. Early diagnosis of this condition reduces the number of blind years and potentially eliminates the chances of severe visual impairment along with saving the life. To conclude, macular JCC is the earliest sign of optic nerve compression that can direct us to an early neurosurgical intervention to prevent visual blindness due to compressive optic neuropathy